One respiration consists of one inspiration, that means breathing in, and one expiration, or sometimes called exhalation, which is breathing out. The chest rises during inspiration and it falls during expiration. When counting respirations, count one respiration each time the chest rises and falls. And I'd like to just show you what that would look like. This will be the breathing in part and the exhalation. Those two together is considered one respiration. Observations to make when you're taking someone's respiration in addition to the speed or the rate at which it's going is whether or not the respirations are deep or shallow. Deep respirations allow for a good exchange of air. That would be considered a deep respiration. A shallow respiration would be very minimal exchange of air and can be troublesome and is something worth reporting to the nurse. Do both sides of the chest rise together? Both lungs should be working together and in symmetry. Are the respirations evenly spaced and in regular rhythm? Normal breathing should be regular and even. Does the patient have dyspnea? Dyspnea means difficulty with breathing. Breathing should not be difficult. It should be painless and it should be easy for the individual. Are there any unusual sounds like wheezes, gurgles, coughs, rattles? All those things are abnormal. Normal breathing is quiet, and any of those extra sounds should be reported. When counting respirations, you would count for 1 full minute, unless the respirations were quiet and comfortable, and in that instance, it would be perfectly all right for you to count the respiration for 30 seconds and then multiply times 2. If you have any question about the regularity of the respiration, then it's safer for you to count it for the full 60 seconds. There are a number of factors that affect respiration changes. Some of the ones that will cause an increase in respiration would be exercise, such as jogging or running. An elevated temperature will cause an increase in respiratory rate, as well as respiratory illnesses, such as asthma, will cause an increase in respiration. There are factors that also decrease the rate of respiration. Drugs, the narcotics such as morphine as a class of drugs that frequently will cause a decrease in respiratory rate. The elderly typically have slower respirations, and those that are terminally ill and near death. Some points to remember with respirations. It's very important for you to count the respirations of an individual without their awareness. Otherwise, they may change the pattern of their breathing. So to best do this, it's useful if you take the person's pulse rate first, and when they're finished, keep your hand in place at the wrist as though you were continuing to take their pulse, with continued pressure applied to the wrist. But the difference is that your eyes would glance up towards the chest, and then you would be observing their respirations. But you would keep your hand at the wrist, continuing to put pressure on it as though you were continuing to take their pulse. And the patient will probably assume that you are continuing to take their pulse and they will continue then to breathe normally. The normal range of respirations is between 16 and 20 a minute. You would want to be sure to report any rate above or below that normal range, along with any other observations about breathing. Now please watch a demonstration of counting respirations. Counting respirations. Wash your hands. Position as for a pulse, sitting or lying comfortably. When finishing counting the pulse, continue to hold the wrist. Count the number of times the chest rises and falls in 60 seconds. If regular, may count for 30 seconds and multiply times 2. Record on a notepad the number and regularity of the respiration. Report any deviations from normal. Wash your hands. Now that you've seen that demonstration on counting respirations, I'd like to talk a minute about reporting and recording of vital signs. Always record the measurements as soon as possible. The longer you wait, the more likely it is that a mistake in reading may have been made. You might forget exactly what it was that you obtained in your recording, in your measurements, and so it's important to record quickly as possible. Carry a small notepad so that vital signs can be jotted down as soon as possible after they've been obtained. Check to be sure that the right measurement is charted in the right place for the right patient. Record in the right place. Some facilities chart on computers, while others will continue to record on graphic or flow sheets. Vital signs are abbreviated and almost always are in the following order: temperature first, followed by pulse, and thirdly, respiration. If a blood pressure has been obtained, it is either before the temperature or is placed after the respiration. Report any deviations from normal to the nurse. Patients have a right to know information regarding their vital sign measurement. Follow the facility policy, as some institutions prefer that a nurse discuss the vital sign measurement with the patient. Now I'd like to move on and discuss some information about height and weight measurement. Changes in weight, particularly, are frequently used as an indicator of a patient's condition. Baseline, also called the original measurement of height and weight, is usually obtained on every patient's hospital or admission to long-term care or home health. Weights are frequently measured when patients are given certain drugs, an example being a diuretic, where there is an attempt to have the patient have an increase in urinary output to get rid of excess fluid. They will want to be checking the weight on a very regular day-to-day basis to determine whether or not the medication is actually being effective in doing that. Weight is also an indicator of the nutritional status of the patient. Height may be recorded in feet and inches, or it might be in centimeters. Weight may be recorded in pounds and ounces, or it might be in kilograms. So you need to follow the policy of the facility where you're working and their recording guidelines, because they do vary from place to place. There are different kinds of scales for weighing people. The most commonly used scale is the upright scale. This scale is used for people who are